You may have noticed in our clinic that we treat lots of babies and lots of toddlers. James's first adjustment was when he was about 2 hours old, when the midwife was doing her newborn examination. I was simultaneously adjusting him. And when people think about adjusting a baby, a lot of people get a little concerned about that, but it's very gentle. Think about if I were to put my finger on a stick of butter and the butter melts underneath my finger. That's how gentle it is when you're adjusting babies that young. When they're mobile, like James is now, you kind of have to chase them down and be really quick about it, but it's still very gentle. A common question that I get is why a baby that young would need to be adjusted. And you have to think that the birthing process, it's very traumatic for baby and mom too. Literally their cranial bones, they're shifting so that baby can fit through the vaginal canal. They're also doing a lot of twisting, turning. Sometimes there's pulling that happens, especially if it's a traumatic birth. So if that top bone shifts, those are the things that can cause ear infections. If the top bone is shifted and doesn't allow the baby to turn their head fully to one side, that's what can become latching issues and affect breastfeeding. Constipation is common from that. Just to name a few. Albert's going to join us too. He gets his adjustments too from a vet who is certified in chiropractic care. But anyways, sit down. Sit. And then also, if it's not fixed, these are the things as the child develops that can become headaches, that can become focus issues. And in addition to that, when babies are young, getting cranial work is very beneficial, because you have to think if there's any part of the brain that has pressure on it, it can affect that part of the brain's development. So you have certain things that develop in the frontal lobe, in the temporal lobe, in the occipital lobe. And if you're at the office, we have pictures of what part of the brain is controlled in which lobe of the cranium. So that would be something really cool to check out. But for toddlers, we have our giraffe adjusting table that they love. Most of the time when they're this young, we just adjust them on mom or dad's belly. But it's just super beneficial for every aspect of their development. So yeah, that's why we see lots of kids around here.